welcome to our Caregiver Learning Series. My name is Brandy Ivy, and I am a community educator with Right at Home, in-home care and assistance. Today I want to share a little bit about 10 questions you should ask before you or your loved one are discharged home from the hospital. We even have a really great handout that I'll be referring to, and we can make this available for you as well. If you would like a copy of it, we can email it to you. So the first question you want to ask is there someone who is going to arrange or advocate for my care? Typically this is going to be a social worker or a case manager, but you're going to want that information of who to contact and their phone number. Also, do I need any kind of care after my hospital stay? This might mean home care, like what Right at Home provides. This might mean home health. There are all different types of services that you may take advantage of after you get home from the hospital. Number 3 is an important one. What medications should I take and what type of schedule? This form even gives you, I'll see if you can see it, a little sample medication template. So it's always great to have that list. Typically, you're going to be given this list at discharge on the day you go home. You'll receive a packet of information and it will include that medication list. But it's still good to ask about it in case you maybe are prescribed a new medication that you're unfamiliar with. Number 4, what activities am I allowed to do and what activities should I avoid? This is great information because sometimes the doctor will prescribe lots of rest and sometimes the doctor will prescribe a little more activity to help you get well. So you really want to know which level of activity and rest that you're supposed to be getting. Number 5, do I have any dietary restrictions or nutritional requirements? This is especially important for some of our older senior hospital patients because swallowing difficulties are actually pretty common, and an altered diet may be prescribed, maybe softer foods, easier to chew, sometimes even pureed or thickened liquids. So it's very important to know your dietary issues. Number 6, what medical equipment will I need at home? You know, you might not be at the same level of mobility that you were before you left home. So you might need a walker, a wheelchair, maybe a cane. Sometimes people need oxygen at home and you're going to have that equipment brought to your house. So it's important to know those things as well. Number 7, do I have follow-up medical appointments and when are they? Studies have shown that people who do not follow up with their appointments after a hospital stay are a lot more likely to go back to the hospital sooner. So obviously you want to keep up with those follow-up appointments and make sure you know when they are. Number 8, what resources are available to me to help with my care at home? Well, one thing that you are already on top of is caregiver learning. Through NARCOG, this is your area agency on aging, through Right at Home, you're going to have access to a lot of different informational videos, handouts. You've got people you can call just to ask questions. So there are a lot of things out there if you just reach out and ask. Number 9, will I be hearing from anybody else from the hospital, and when would I expect to hear from them? Sometimes hospitals will do like a follow-up phone call, a patient survey type of thing. They'll call to check and see how you're doing. You know, the transition from hospital to home can be so difficult that hospitals are really trying to help make that a little bit easier and avoid people going home and coming right back into the hospital. Number 10, what red flags or changes in my condition should I watch for? There again, you want to know what's okay and what's not. If I go home and I have one symptom, is that something to be alarmed about or is that perfectly normal? Maybe signs of infection. If you have an incision, you want to know what to look for there as well. So luckily most hospitals are going to go ahead and go over these 10 things with you, but just in case maybe something gets overlooked, it's really great to have that idea. Hope this helped you out today, and if we can help in any other way, don't hesitate to call us. Have a great day. Bye-bye.